I recently had a health checkup, and they said my liver levels were high. They mentioned it might be fatty liver, and when I looked it up online, I found out how serious it can be.
Fatty liver can indeed lead to significant health problems if left untreated. Essentially, fatty liver is a condition where excess fat accumulates in the liver cells. This can cause inflammation in the liver cells, and eventually, it can progress to cirrhosis or liver cancer.
Thank you. Your explanations are always so clear and helpful. I wish more people could benefit from your easy-to-understand medical explanations.
Thank you. We actually run a YouTube channel to share our information with a broader audience. If you find this content useful, I recommend subscribing to our channel. By subscribing, you can receive the latest health information and advice.
That sounds great. I just subscribed now. It was really easy, just a click on the button at the bottom right of the screen. So, can you explain more about fatty liver? Does it cause inflammation in the liver cells if left untreated?
Yes, leaving fatty liver untreated can lead to various health issues. Initially, there are often no symptoms, but over time, the fat accumulation can cause liver cells to become inflamed, leading to hepatitis.
Does hepatitis cause pain?
Actually, the liver has few pain receptors, so inflammation often doesn't cause noticeable pain. However, as hepatitis progresses, liver cells can be destroyed, and scar tissue can form. This condition is called cirrhosis. When cirrhosis occurs, liver function declines, and the liver can no longer effectively process toxins in the body.
Cirrhosis sounds serious. What happens if it progresses further?
Yes, cirrhosis is very serious. If it progresses further, the liver cells can become cancerous, leading to liver cancer, which is the most feared outcome. For example, a man in his 40s with a history of heavy drinking and an unhealthy diet might progress from fatty liver to cirrhosis and eventually to liver cancer.
Doctor, I heard that fatty liver can affect other parts of the body as well. Is that true?
Yes, that's correct. Fatty liver can impact overall health, not just the liver. It is associated with an increased risk of cardiovascular diseases and diabetes.
What kind of cardiovascular diseases are we talking about?
Cardiovascular diseases include conditions like atherosclerosis, heart attacks, and strokes. For instance, patients with fatty liver are more prone to developing atherosclerosis, where the arteries harden and narrow, increasing the risk of heart attacks and strokes.
That's frightening. Can you also explain the connection with diabetes?
Of course. Fatty liver is closely linked to insulin resistance, where the body cells become less responsive to insulin, causing blood sugar levels to rise. This is a significant factor in the development of diabetes. Many patients with fatty liver also have diabetes.
That sounds like it could affect daily life a lot.
Indeed. Diabetes can lead to vision problems, numbness in the feet, and slow-healing wounds, among other issues. Additionally, advanced fatty liver can affect other organs like the kidneys and pancreas.
I see. My health checkup results mentioned AST and ALT levels. What do these mean?
AST and ALT are enzymes found in liver cells. When liver cells are damaged, these enzymes are released into the blood. AST is sometimes called GOT, and ALT is sometimes called GPT. In fatty liver cases, ALT levels tend to be particularly high. Gamma-GTP levels can rise with alcohol-related liver damage or bile duct issues but can also be elevated in fatty liver. CHE, or cholinesterase, is another marker of liver function and can be elevated in fatty liver.
How high do these levels get with fatty liver?
In early-stage fatty liver, AST and ALT levels might be slightly above the normal upper limit. However, as fatty liver progresses or turns into non-alcoholic steatohepatitis, these levels can rise to 2 or 3 times the normal range.
I'm also concerned about uric acid, triglycerides, blood sugar, and HbA1c levels. Are these related to fatty liver?
Yes, individuals with advanced fatty liver often have elevated levels of uric acid, triglycerides, and blood sugar. It's common for them to have other concurrent conditions.
How can I improve these levels?
Improving your diet and getting regular exercise are crucial. It's also important to limit alcohol intake. Aim for a balanced diet with plenty of vegetables. Choose sustainable forms of exercise that you can incorporate into your daily routine.
Thank you. I'll work on improving my lifestyle for better health.
That's a great approach. Improving your lifestyle can benefit not just fatty liver but your overall health. If you have any questions or concerns, feel free to reach out.
Thank you. But, doctor, honestly, I'm very uncomfortable with hospitals and doctors. The thought of talking to a doctor makes my heart race.
I see, that must be tough. Finding a doctor you feel comfortable with can help. Checking out their website or YouTube channel before your visit might make you feel more at ease.
That's a good idea. I'll try visiting the hospital. Doctor, thank you. I'll continue to seek your advice.
Of course. Please watch our other YouTube videos as well.